Good morning, Dr. Leonard.
Good morning.
I'd like to ask you some questions about Dr. Condon's actions in treating Mr. Daly.
Absolutely.
You would agree with me that Dr. Condon didn't completely rule out the possibility of a seizure disorder, that's true?
No, he didn't rule it out. He recognized it and he made note of it.
Exactly. Dr. Condon made note of the possibility after his first visit with Mr. Daly, that's true?
First visit and third visit.
Exactly. Dr. Condon revisited the possibility after their third visit together?
Yes.
And it was after their fourth visit together that Dr. Condon ruled out the possibility of a seizure disorder.
That's true, after increasing the dosage of the seizure medication.
So just to be clear, Dr. Condon did rule out a seizure disorder after their fourth visit?
Yes.
Dr. Leonard, you're familiar with why Mr. Daly was meeting with Dr. Condon, right?
Yes, he was attacked and suffered severe head trauma.
Exactly. It's your understanding that Mr. Daly was beaten in an ice cream store parking lot, I think?
Unfortunately, yes.
And you would agree with me that Mr. Daly suffered injuries?
He did. He had a brain bleed, he had a fractured eye socket, as well as other severe head trauma-related injuries.
Exactly. Mr. Daly was hit repeatedly in the head, wasn't he?
Yes.
And you would agree with me that getting hit in the head repeatedly can result in a concussion, right?
Yes.
And you would also agree with me that someone who suffers from a concussion can develop what's called post-concussion syndrome. That's true?
That seems to follow logically, yes.
So I'd like to ask you a little bit about Mr. Daly's first meeting with Dr. Condon. You're familiar with the symptoms Mr. Daly reported then, right?
Yes, I am.
And this included gaps in memory,
Yes.
bad headaches,
Yes.
loss of concentration,
Blurred vision, too.
and loss of focus, that's right?
That's right.
Dr. Leonard, you would agree with me that each of those symptoms are consistent with a concussion, right?
They're consistent, yes.
Now I'd like to ask you some questions about those records you reviewed. You remember those records, right?
I do?
There were 4 of them?
Yes.
And based on that information, that was part of the information you used to come to your conclusions today, right?
Part of it, yes.
And you concluded that Mr. Daly was suffering from a seizure disorder, right?
I actually concluded that Mr. Daly should have been diagnosed with a seizure disorder, or at the very least, it was Dr. Condon's duty to order further diagnostic testing.
Okay, that's fair. So part of your conclusion then was that Dr. Condon at least should have seen a seizure disorder, right?
Yes, he either knew it was there and failed to do anything about it, or at the very least, the standard of care required him to do further diagnostic testing. That was my evaluation.
I'm sorry, Dr. Leonard. Directing you back to my question, you believe that Dr. Condon should have seen a seizure disorder. That's true?
Yes.
Dr. Leonard, you would agree with me that Dr. Condon was working off of information that Mr. Daly gave him, right?
I would agree with you there, yes.
Mr. Daly was describing his symptoms to Dr. Condon.
His symptoms.
He was describing events that were happening to him to Dr. Condon, right?
Yes.
Dr. Leonard, you would agree with me that in your expert medical opinion, it is difficult, if not impossible, to rely on the description of the events of a seizure from the person who suffered it. That's true.
That's true, but that's solely the events. When a seizure happens, the patient will be unconscious. So it's almost impossible to rely on their description. Somebody would have to witness them having the seizure.
Dr. Leonard, just to be clear for the members of the jury, your answer to my question was yes, it's difficult, if not impossible, to rely on the description of the events of a seizure from the person who suffered it. That is true.
Yes, the event of a seizure.
Thank you. Dr. Leonard, I'd like to ask you some questions now about a drug you mentioned on your direct examination called gabapentin. You're familiar with it?
I am.
You mentioned on your direct examination that it's used for treating seizures, right?
That's what it's FDA approved for.
You actually mentioned during your direct examination that it would be odd to prescribe gabapentin for any other purpose. That's what you said?
Yes.
Dr. Leonard, you're familiar with another use of gabapentin, aren't you?
The FDA approved uses or the off-label uses?
There's another FDA-approved use for gabapentin, isn't there?
Yes, shingles.
Exactly. More specifically, gabapentin can be used to treat for what's called post-herpetic neuralgia, right?
Yes, shingles.
And you would agree with me, actually, that that means it's the nerve pain resulting from shingles. Isn't that true?
That is true.
So there are, in fact, 2 different uses for gabapentin on label. That's right?
Yes.
And you briefly mentioned something called off-label uses. I'd like to explore those a little bit. You're familiar with what an off-label use is, right?
Yes,
And that's where you use a drug for a purpose other than what's on its FDA label?
that's correct.
And you would agree with me that it's common to use gabapentin to treat certain mood disorders. That's true?
That's true.
Now I'd like to ask you some questions now about some more of Bobby Daly's symptoms. You recall that Mr. Daly was suffering from anxiety?
He was.
He's suffering from irritability too, isn't that right?
That's true.
And you would agree with me that at their 4th visit together, Mr. Daly told Dr. Condon that his irritability was getting better.
His irritability, yes. I'm not sure about his anxiousness.
But just to be clear, Mr. Daly's irritability was getting better. That's true.
That's true.
Dr. Leonard, I'd like to ask you some questions now about your involvement in this case and how it relates to Dr. Condon. Dr. Condon met with Mr. Daly over the course of 9 months, right?
He did.
From about June 2015 to March of 2016, I think that's right?
That's true.
And that included 4 different meetings as we've covered.
Yes.
Dr. Leonard, Dr. Condon has met with Mr. Daly 4 more times than you have, that's true?
Yes, that's true.
And Dr. Condon was the one who came to a diagnosis in this case?
Yes, although not the correct one.
But just to be clear, Dr. Condon made a diagnosis.
He did make a diagnosis.
And Dr. Leonard, as you previously stated, you did not make a diagnosis in this case.
No, my job was to evaluate Dr. Condon's steps in his diagnosis.
Dr. Leonard, just to be clear, you did not personally make a diagnosis.
I did not.
Mr. Daly was never your patient.
As I said, I've never treated him.
You've never met Mr. Daly.
No.
And Dr. Leonard, you'd agree with me that you did not observe Mr. Daly driving on September 4th, 2016. That's true?
No.
Thank you, Dr. Leonard. Your Honor, I have nothing